Hello, I'm Congressman Chet of Texas, and I'm pleased to be able to take part in the DAV's virtual March on Washington for Veterans. As a longtime veteran supporter and as chairman of the House Appropriations Subcommittee on Military Construction and Veterans Affairs, I'm grateful to the DAV for organizing this tremendous event and allowing me the opportunity to take part in it. Honoring our troops, our veterans, and their families in a meaningful way is not only the right thing to do, it is the smart thing to do. In an all-voluntary military force, the best in the world, we cannot expect to attract and retain the best and brightest if we don't provide high-quality housing, health care, and education for our military troops and their families, and if we do not keep the promises we have made to our veterans. Since January of 2007, when I became chairman of the VA Appropriations Subcommittee, Congress has taken great strides towards ensuring that all of the men and women who have served in our armed forces can receive the health care services and benefits they have earned. I'm proud that working with the DAV, Speaker Pelosi, Chairman Obey, and Filner, and other leaders in Congress, we have provided a 60% increase in funding for veterans' health care and benefits, the largest increase in our nation's history in just the last 2.5 years. In addition, we have a new 21st century GI education bill that duplicates the benefits of the World War II GI Bill and allows spouses and children to receive the education benefits, including every child whose parent has died in military service since September 11th of 2001. I believe our veterans have earned every dime of this funding. As a result of the historic increases Congress has passed, we have seen a total increase of 8,300 claims processors in the VA, 145 community-based outpatient clinics, 70 new vet centers, and more than 47,000 additional VHA employees. These additional resources will provide our veterans with their benefits more quickly and improve access to health care and other services. We have targeted funding to help veterans suffering from traumatic brain injury, PTSD, and other mental health care problems that are the result of battle. The mileage reimbursement rate has been increased for the first time since 1979, from 11 cents per mile to 41.5 cents per mile. Also, for the first time since 2003, we've increased the income limit for non-service connected veterans to qualify for VA health care. Congress has also funded, with the help of the DAV, several initiatives to improve the quality of life for our military and their families. $2.8 billion for new military hospitals, $1 billion for new child care centers to serve 20,000 military children, and $570 million in additional funding for barracks. To meet these obligations, we've taken historic action by including $48.2 billion in advanced appropriations for veterans' medical care in 2011. With advanced appropriations, the VA will have the resources it needs and deserves when it needs it to provide timely and quality health care to all enrolled in veterans. This reform of the VA healthcare budget process was first brought to me by DAV and other members of the Partnership for Veterans Healthcare Budget Reform, and I was pleased to include it in the VA Appropriations Bill for fiscal year 10 and work with the DAV to pass it in the House. I'm also committed to tackling the growing backlog of claims for disability compensation and other benefits. The VA is currently heading toward a backlog of 1 million claims that remain unresolved. That means there are hundreds of thousands of veterans and their survivors who continue to wait months and even years to get the benefits they deserve. In the past 2 years, we provided the VA with the funding to hire and train thousands of new claims processors and rating specialists. However, without fundamental reform of the system, this problem cannot truly be solved. That's why I'm eager to work with the DAV and other veterans organizations to develop a comprehensive reform that will finally fix the claims processing system. DAV's 21st Century Claims Processing Proposal contains a number of innovative and vital recommendations to solve these problems. We will also need each of you participating in this virtual march to continue spreading the word and building support to end this shameful backlog. Let me close by saying that the bills we pass and the budgets we adopt can be great accomplishments, but what we do in Congress is more than just that. It's about the moral obligation of our nation to stand up for those who have stood up for all of us. It is about the young father in a wheelchair I met at Walter Reed Army Hospital. He lost both of his legs in combat in Iraq. And as he sat there talking to me with his young son in his lap, while I had my two sons next to my side, I could not help but be overwhelmed by the lifelong sacrifice this father had made to try to make the world a safer place for my two young sons and children everywhere. What we do in Congress can help to ensure that that loving father doesn't have to give up the dreams he has for his child. I'm humbled knowing that we can never fully repay the debt we owe this soldier and all of you who have served in uniform to protect the American family. I'm inspired to continue working together with the DAV and each of you who've cared enough to join in this virtual march to strengthen the VA and veterans programs. After years of inadequate budgets, we are now marching, thanks to the DAV, in the right direction. With your help, our nation will honor our veterans not just with our words on Veterans Day, but with our deeds and budgets every day. God bless you for defending our great nation and those who protect it.